I'm Ed Corby, your host. Our guest today is Pam Landry, Senior Systems Consultant. Pam and I have worked together for several different companies over the last 23 years. I've gotten to know her, and I know she knows healthcare backwards, forwards. She knows healthcare and software impeccably. Well, today Pam is going to explain the steps towards an electronic medical record. Her topic is going to be integration and interoperability. But first, let me begin by letting you know a little bit about who Formfast really is. More than 1 out of every 5 hospitals in North America who choose to eliminate paper processes choose Formfast. They choose us to lead them through their EMR process. And if the facts are told, it's actually closer to 1 out of every 4. Now that's an amazing figure considering that only 15% of hospitals today in America even have a program for elimination of paper and an improvement of their processes in place. So, having said that, we began in 1992. And we began as a company that helps you with your printing processes. We were incorporated in St. Louis. We have over 700 plus end users. We look at printing technologies like face sheets, pre-admissions, any type of form Formfast can help you with. It can help you with any type of workflow application that needs rules, roles, and control by your organization. So when you look to Formfast, you can look to our technology to help you in any department in your entire enterprise. And when it comes to workflow, well, we can help any type of application that's out there that you need to fill in on the screen. Any application surrounding that paper process can be greatly improved while running a document to cold feed for the electronic medical record. And that's what we're really going to talk a lot about today, is why you have chosen us, and not so much that as to what you can do in implementing your EMR. Any eForm can be filled in on the screen with complete workflow process. So why choose Formfast? Because we've been a leader in the marketplace. We have partners, as you see down at the bottom, that we can integrate with, and almost all of you have those applications and our partners in your hospitals. Because of the dominance in the marketplace and the financial stability, we've been chosen to be number 1. So without ado, what I'm going to do is introduce our guest speaker today, Pam Landry. Pam, welcome.
Thank you, Ed. Welcome, everyone. These are the topics that we're going to talk about today, and the anticipated outcomes from manual processing reduction. We're going to talk a little bit about some factors involved in document imaging and archiving that we want to consider, cold feed, and the details surrounding what that process requires. Then we're going to cover some information about user setups and rationales involved there, as well as some document data sources and how they might be used. Along with that, towards 3/4 of the way through, we're going to talk a bit about the e-signatures and the impact that they can have in the information that we're gathering. And we will end our presentation today with a discussion relaying information concerning automating workflow processing. So let's move into our first topic. Let's talk about what the outcomes from manual processing reduction might be as far as what we might anticipate for that. Once paper documents have been converted using a tool like our Form Designer, which I believe was discussed in last week's webinar, These documents then should be stored such that they could be retrieved and updated. One of the key objectives then of manual processing reduction is to select and utilize a more user-friendly storage option than before. Oftentimes, this is an electronic repository. Among other considerations, one of the key points in this type of a consideration and move towards more electronics is the financial implications, because these often drive the decisions for the individual pieces that might make up the entire system. This is due to the long-term savings that can be realized when paper storage or possibly microfiche are no longer required. It also can allow an organization to look at when the physical storage space is freed up. Say in the example of you may be still storing the paper documents. If this is freed up and this is within the organization's facility, then that might be utilized for additional staff space, thus reducing any cost for some potential expansion that might be targeted for a particular budgetary year. If you will, a redefining of existing space cost versus the cost of building new space. And then again, with the elimination of obsolescence that is associated with this conversion to electronic forms and document storage, there is reduced destruction costs that are a natural result. When we looked at the possibility for improved control, we look in reference to the utilization of imaging compliant templates. Version control is then improved and scanning rejection rates are improved. So these are a natural result of utilizing those templates. And by allowing old versions to be eliminated from use, electronic storage of forms also promotes an improved chart makeup on the front end, including the use of auto-printing of gathered data and workflow features in the overall system offers further improvements by reducing manual operations at the beginning of the process. Now let's talk a little bit about document imaging and archiving. First off, imaging and archiving is a process action, and the imaging is performed in conjunction with the archiving action. So there's a two-part process. Then you prepare these electronic documents for eventual archival use, which usually involves the ability to search and view the documents that have been stored. The ability to include additional secondary electronic entries such as e-signatures is dependent upon different archiving system requirements, as are some of the target items that require compliance in the archiving system as well, such as person, record or visit identifiers, in addition to a document or form type identifier, such that the searching can provide the user with the appropriate documents. When we talk in terms of auto versus manual indexing, this is really referencing the ability to cut down on the costs and time involved in manual indexing. However, we want to understand that initially there probably will be some documents that may have to remain paper, so you automate as many of those that you can in the beginning and reduce the time spent and improve the cost factor associated with the remaining manual indexing. You can enhance this further by the addition of barcodes on the documents, and possibly even the use of a barcoded label to provide patient information. some of the type of documents that might fall into this category could include, for example, clinical flow sheets that may need their system and process revamped and redefined such that the documents will more readily work within an archiving system for viewing presentation. Other items that might end up in that same category might include, actually definitely would include, any documents that are scheduled for decommission, meaning they're going to become obsolete in the very near future, so you may choose not to include those. So the outcomes of this two-step process is going to be an image file that's associated with a specific patient, an image enhancement over a previous method, especially if you were still storing paper documents and you don't have to worry about supplies and being able to retrieve microfiche. And the automatic data and document capture for archival viewing, again, so that you don't have to submit a request to have paper documents supplied or to request a specific microfiche reel. All right, let's talk a little bit more about the archiving, just making sure that the process is recognized as a two-part. You're talking in terms of imaging, you're imaging the document with patient information on it. When you're talking in terms of archiving, you are archiving not only that image of the document that you are saving, but you are also utilizing some identifiers that will assist you with searching and viewing of those documents from the archive. The attributes that are associated with archiving include the indexing and data capture, as we've mentioned. The index file, if it is utilized, is archive system specific. By that I mean that we are looking at a specific format that is required for the archiving system, meaning the actual makeup, where is the person identifier, where is the record identifier, and that type of information. May even include a facility code if that is a multiple facility organization. The archive export location is also specific to the system, and in that way that would be typical in that there's going to be a specific directory, if you will, where these are going to be imported into the system. The data captured can also relate to the patient associations, and those include the person identifier and the visit identifier or account number. So the outcomes of this part of the imaging and archiving system is improved retrieval time based on those identifiers, improved information access such that you don't have to submit a request. You just need to have authorization to be able to search and view, and the improved access convenience, also related to the ability to search and review.
Okay, it's time for polling question number 2. And the question is, would you like further detail on how Formfast enhances your existing or planned scanning or cold feed? Okay, Pam, next slide.
Thank you, Ed. Now we're going to talk a little bit about user information and what that might mean. Users need to have the appropriate authorization to access various parts of the system, which allows them to perform their appropriate job functions. This restricted access is initiated through the use of user IDs and passwords. During the implementation process, there are several ways that you can input information to build a user base for this security feature. I'll be using the Formfast solution as my example. So we're going to talk in terms of LDAP, which is an Active Directory resource. The user names in Active Directory may be gathered and imported to participating modules that utilize the LDAP functionality. LDAP, as you may know, stands for Lightweight Directory Access and references the protocol for querying, and in this case, importing users to another Windows application. When this is a scheduled task, the functionality allows the bulk of users to be imported on the first retrieval cycle. On subsequent retrieval cycles, new users are added. The Formfast modules that utilize this feature, when there are users designated within its list as LDAP users who aren't present in subsequent retrieval cycles, these are then automatically removed. An alternative to the LDAP methodology for importing users, the administrator may opt to, based upon the organization's requirements, to enter in a group of users and employ the feature that allows them to put in a password when the user is created, but then on the first try, the user is requested to change their password. Subsequent users are then added as the rollout phase continues to their areas. As a side note, as I mentioned, the controlled rollout, this approach allows an organization to create champions within each department as users become accustomed to new processes. And this can be beneficial for an organization as they move forward. And then, of course, the very last one here, the administrative entry. If it is deemed that this is the preferred method for an organization and will offer them the greatest benefit, the Formfast administrator may opt to enter all the potential users manually and do this all as a global rather than a rollout possibility, meaning all users are entered before any type of rollout begins. The document data is an important part of the associations for the archival use. As we mentioned, person ID or patient ID is typically medical record number. A record ID references typically an account number, a visit number, or an encounter number, depending on the terminology utilized in the organization. And the document and or form type is the actual overlay that is being imaged with patient information on it. By utilizing already available data to populate documents with common fields, a consistency of information provided is achieved. This consistency flows through each document or form and each occurrence or visit and is unchangeable by the end user. Examples of data gathering mechanisms might be a virtual printing of admission data to Formfast that then Formfast passes that data to the archival mechanism. It may encompass an ADT feed of patient information gathered at registration and forwarded to a receiving mechanism such as Formfast HL7 Patient Tracker. To populate an ODBC compliant database that provides the patient information to populate any demand printed forms after registration. In addition, FormImprint's ability to provide a mechanism for gathering electronic signatures and dates, initials, etc., as a part of the registration process is a natural progression from the host data to Formfast, to signing in FormImprint, to archiving, allowing you to have those secondary entries added. Adding a barcoded label to a document during the visit assists in reducing time during the manual scanning operation, as we previously mentioned. An example scenario that I didn't mention earlier might be a downtime situation if a downtime application was not included in an organization's Formfast solution. To e-signatures. There have been several regulatory attempts to define what an electronic signature is, and the ones that we've listed here on the slide are basically the ones that are most often encountered. The first one there, the UETA 1999, was added on to and became the U.S. e-Sign Act of 2000. And then, of course, there is the Canadian PIPEDA. If you need expanded information on any of these documents, you can search the Internet for those and arrive with a selection for the appropriate government organization that would provide you with those in a PDF format. From America's standpoint, page 10 of the e-Sign Act defines electronic signature as an electronic sound, symbol, or process attached to or logically associated with a contract or other record and executed or adopted by a person with the intent to sign the record. From the Canadian standpoint, an electronic signature is described as one or more letters, characters, or symbols in digital form associated with an electronic document. E-signatures provide several benefits to organizations who embrace this technology, including the ability to image and archive provided signatures on the documents to which they've attached. The original signed document can be provided to the patient following electronic signing, eliminating any question of whether or not the patient received a signed copy. A third advantage is to the hospital's clinical staff. For example, physicians can view signed documents such as consents or other pertinent documents requiring patient authorization and verify that those have been secured. In the Formfast solution, the form imprint signing activation process is controlled by the Formfast administrator, but enacted by the end user, or in the admission case scenario, the registrar. Signature encryption is device-dependent, associated with the image or document that's been signed, and requires the associated image to de-encrypt.
Pam, I threw in a couple pictures here for our audience, and these are sample signature devices.
Thank you, Ed. What we have here is really a nice display. The first one is one that is an interactive LCD display, much like you might see if you were signing electronically for your credit card, whereas the secondary one is more of a clipboard looking, such that your forms can be placed on it and signed. Thank you, Ed. When we talk in terms of cold feed, we're talking in reference to an imaging and archiving system acceptance method. Remember we talked about how these would be sent to us, the files, the image files, and an index file, if necessary, would be sent to a specific location for importing by the archiving system. The cold feed technology has virtually replaced archiving paper documents and microfiche technology for storage purposes in the last few years. When Formfast co-feeds a document to an archiving system, it's typically a face sheet. However, it could be any form in the admission packet that doesn't require secondary completion. One that comes to mind that I've recently seen is an important message from Campus, and that one did not require a patient signature on it, but was a handout. Other handouts might be information on smoking policies within the facilities such that they just need to have a copy of it themselves, but you want to be able to record that it was indeed provided. Some of you may know Coldfeed by its newer name, ERM, or Enterprise Report Management. Whatever the term may be, the technology offers more timely access to data than previous methods. It consists of both software and hardware being typically optical disk drives. The software component allows the documents to be received, organized, and the storage compression is typically a feature. In the Formfast solution, the Print Manager module can automatically export images and index files directly to the designated location for the imaging archive system to import. So those documents that are sent immediately via the Coldfeed process will be visible very early in the patient's visit. Through the use of the creation tool, the appropriate person, record, and document type identifiers are provided, and then those are available for the archiving system to utilize. Since the admission data is initially supplied directly by the HIS system, information accuracy is 100%. Let's talk a little bit about workflow processing. Workflow processing can be defined as the digitizing of a business process by incorporating screen completion of fields and electronic routing of associated electronic documents within that business process. Having said all of that, let's summarize that a bit. Workflow processing's ability to digitize a business process, moving it from a paper-based process to electronic routing, thereby improving the productivity of the employees who may be involved in a particular workflow process. Achieving this evolution improves productivity, reduces the process time, and adds the ability to trace and address potential bottlenecks in the process. For example, if a workflow process has a document in it that is routed to an individual who is on vacation or away at a seminar, or they're in a meeting for the entire afternoon and it must be a determination made on it from their aspect, rules can be put into place on an electronic workflow routing that allow it to be forwarded to an alternative person so that it may receive the attention that it needs in a timely manner. This is typically not available in a paper-based workflow, in that particular document may not be seen for several days or the next day, and it may not be soon enough for the disposition of the action that is a result of that particular document. So if the process gets bogged down at one person's desk, the additional reminders can also be set in addition to the rules added to accommodate when key employees in a process are away and out of pocket. The Formfast solution for workflow processing is known as FastFlow and is a web-based product that assists the organization with implementing the electronic workflow processing and does indeed include routing and possibly a document repository as well, so that we combine those two things from the one from the beginning with the ultimate workflow processing. Electronic routing is a key feature of FastFlow and should be a key feature of any workflow processing that has moved to an electronic methodology. Other key features include authorized user access, multi-level permission types, anything from the basic user level, users who can upload documents, workflow owners, and user groups. It's also possible to have pre-fill fields allowing the creation of intelligent forms to be a part of the electronic workflow. Pre-filled fields may be anything from today's date to employee names, their departments, and other pertinent information dependent upon the actual document in the workflow. FastFlow promotes the improved productivity through quicker access and processing of documents within the given business process, which is the ultimate goal of a workflow processing application that digitizes a business process and includes electronic routing. The administrator has the ability to regulate those access levels that are available to users to keep system security at the forefront. Workflow processing contributes to long-term financial savings by the very nature of implementing an electronic system and removing paper and manual steps. The benefits of utilizing current up-to-date documents in electronic format further improves the bottom line and increased productivity with current staff levels. And this is important in today's economic times. Predetermining the detailed process flow and actions desired at each workflow stop in advance of implementing an electronic routing process allows the digitized business process to flow smoothly upon initiation. Most individuals who are involved in electronic routing prefer to draw a small, simple workflow chart utilizing symbols that they can then add to as they discover the additional routing locations that may be necessary or digitized signatures that may need to be added at different points along the route. An enterprise solution is usually oriented towards organizations with large networks, such as are found in hospitals. As such, the ability to have scalability options and efficiency potential become very important, right along with the multiple security options. Initial costs, such as training sessions, should be offset by software features. For example, Formfast offers training sessions for each included module in the overall system. This is supplemented by tech support assistance available to accommodate whatever the contractual agreement has been that benefits the organization. Add to that the use of intuitive screens that encourage learning, and an operator can be proficient in a short period of time. Additional benefit of explanatory help screens is that they promote additional self-learning. Implementation management steps might include establishing project team members and responsibilities, determining milestones, and outlining version control processes. If we do a summary and a review based on the Formfast Enterprise solution, we can see the different areas that need to have concentration in order to achieve a successful implementation. Security is paramount to most hospital locations. The print manager is available only to a selected administrator, is transparent to initiators such as registrars. They never see the product. They just see their documents coming off of their printer in the case of those that need to have paper output at this point. The Form Imprint module also requires a user ID and passwords or utilizing the LDAP technology. FastFlow requires usernames and passwords or the LDAP technology and is also administered by typically a single individual and possibly a backup. Scalability. Multiple modules that can be simultaneously used or strategically added. This allows an organization to proceed at their own rate of moving towards an electronic enterprise solution. With a single setup tool, this provides the documents with the appropriate data information pre-filled in the case of admission documents for both Print Manager and Formfast modules. In the case of the Formfast Print Manager, it can be employed to automate such systems as admissions, providing cold speed ability to archiving systems, including any of those files that are necessary for the archiving system to be able to index and provide searching capabilities and viewing. It can also be employed to further enhance admissions by utilizing its e-signature ability to provide additional information to archiving systems. FastFlow's repository provides storage capabilities for electronic documents, while its workflow aspects provide viewing, routing, and process advancement capabilities. These are all items that would be of concern in moving to an electronic solution. The third one here, advancing technology, indicates that the selection of software needs to be able to have some consideration towards the server operating system capability measures as those progress over time, to provide periodic software upgrades to increase features that are found to be more of an additional benefit to the organizations using the software, and as the .NET compatibility, that is an example of a technology that has been incorporated into Formfast products as a result of understanding the need to continue to advance technology in the products. So security, scalability, and advancing technology are key components of an enterprise solution.
Okay, Pam. We already have some questions coming in. And Pam, I will direct that first one to you. What types of documents or forms may need to remain paper-based? That's a great question.
So this might include the oversized clinical flow sheets that we talked about. It might also include multi-part form sets that need their process reviewed to determine how many copies need to actually be utilized at this point in time. And obsolete documents, those that are going to become obsolete in the near future, may be the last ones that you implement because it may be that that time frame expires and a determination might be to include it. Otherwise, if they are going to become obsolete, then they would not be included. And one final one that that comes to mind is possibly a copyrighted form or document. I'm thinking in terms there of infant growth charts that may be provided by formula companies.
Wow, that's great. All right, here's another one that just popped up. What types of barcodes are typically used?
Okay, that's a good question as well. There are a number of barcode symbologies out there, and that selection is typically driven by the archiving system's requirements. However, the most commonly encountered ones that I've seen have been code 3 of 9 or code 128. The Formfast solutions offer additional symbologies in addition to code 39 and code 128. Such as 2D barcodes, although those are prevalent at this point.
Okay. All right, here's a question here's one that's from Derek, who's been really kind during this. He's let me know off and on that what's been going on the screen. What method of integration is being used? Would I need to work with my EMR vendor to allow uploading?
It is probably going to require some coordination because it will need to have some type of uploading for the EMR. Oftentimes what I've seen is that the EMR is a part of that viewing and searching mechanism with the archiving system, such that the chart is visible not only today but after the patient leaves the hospital, is discharged. So the method of integration is going to have to be a cooperative one where you'd have to initially decide where you want to go with it and how far you're going to take it, and if you're going to do it in phases such that you would be able to recognize what pieces of software that are currently involved or might need to be involved.
The other thing is, Derek, in terms of your EMR vendor, we have a plethora of partners. Even though you saw a list of them, that's not all we have. So many of the vendors are already, we work with and we're already interfaced with. So what you really need to do is speak with one of our regional folks and talk to them about what your goals are, and then they can clearly tell you, based off the information when they're on site, exactly what you need. All right, we've got another question here. Pam, can you explain what is meant by an imaging compliant template?
Yes, Ed, and thanks for your contribution there. That's a great idea, speaking to regional people. What is meant by imaging compliant template? There's two aspects to that. One refers to utilizing a design template configured for spacing and barcoding specs for a specific archiving system. The other refers to providing the proper index file format and identifier fields that will be utilized.
All right, and we've got one final question before we end the seminar. How would the workflow part of Formfast solution work with Meditech Magic?
Okay. When we look at Formfast solution for workflow processing, that would be the FastFlow product. And it has the ability to receive an import of user information from Magic, information such as employee names and departments and mnemonics, telephone numbers, email addresses, etc. So, however, being web-based, FastFlow moves an organization beyond this information and then dependency by the workflow routing for many different types of documents, improving productivity and enhancing the benefits of routing.
Well, thanks, Pam. I know that the information Pam gave today is going to be available on our website. You know, you can contact me, your host, eCorba, at formfast.com. It's in your invitation for the review as well as reviewing the entire seminar series again. Now, as it stands, our next seminar is going to be July 30th, and it's going to be part 3 of our 3-part series of the electronic medical record, enterprise implementation of the EMR. So for the next week, join us in the Formfast auditorium to hear how to build your EMR. I want to thank Pam Landry for being our guest today. She did an absolutely, and on behalf of Rob Harding, Sean Curtis, John Yock, and the entire Formfast sales team, I'm Ed Corba, wishing you the best for 2009. We'll see you next Thursday as we finish up this 3-part series on the EMR. Survey come out afterwards. Please take a moment, fill it out, let us know how we did. You be good. Have a great, I sure look forward to seeing you in the future. Bye now.